welcome back to Public Sector Voices with Emily Rodgers. On today's episode, we're joined by Cllr Fiona Venner, Executive Member for Children and Families at Leeds City Council. Cllr Venner has been at the forefront of launching a new support system alongside 14 other local authorities to help families dealing with relationship breakdowns or difficulty throughout the coronavirus crisis.
Hi Fiona, thank you for coming to speak to us today on Public Sector Voices. I know you're probably really busy trying to support the families across Leeds. Can you start by telling us a little bit about how the past few months have changed the way that you've been working?
It's been a really interesting mix, actually, Emily, of working completely differently and some forms of business as usual. So within the Children and Families Directorate, all our children's homes are operating as usual. Our children's centres, we've had 13 open as hubs, providing childcare for key worker children and children classed as vulnerable. But in other ways, it's completely different because obviously we've had the pandemic. So normally at this time of year, I'd be going to lots of events. So we have the Stars Awards in the summer, which is a big awards ceremony for looked after children. There's lots of enrichment activities for children and foster families, lots of different events and meetings, and that's all happening really differently. So the way we've been running the department, we've had 3 multi-agency meetings a week in the 3 different areas of the city. And we've been working with a partnership of children's social care, schools, our early help hubs, and third sector organisations like charities and community groups to look at how we support families who most need support. Mm-hmm. So although schools have largely, have only been open for key worker children, children with social workers, children with educational health and care plans, actually schools have been doing a huge amount of work keeping in touch with families, making sure they're okay, making sure they've got food and they've got the support they need. Our early help hubs have been distributing food and nappies and essentials. So we've been working in that coordinated way to make sure that families that we're concerned about are still in contact, even if we have to do that contact differently. Yeah. And then I chair the Child Poverty Impact Board, and I also chair a board called Future in Mind that's about children's mental and emotional health. And those meetings have gone ahead online because we're really aware that the mental health impact and the economic impact of the virus are going to last a lot longer than the pandemic itself. And so we need to be planning for the future. So it's been a really interesting mix of business as usual and completely different and new ways of working.
Yeah, it sounds that. And have you found it kind of more stressful having to do everything virtually?
Yes, absolutely. I think I live on my own and I would never choose to spend the amount of time on my own as I am at the moment. I'm used to a 12-hour day being surrounded by people, and working virtually is very different. And although you can set up meetings and you can ring people, you miss a lot of those incidental conversations. And I think some of our frontline staff are finding that. Of course, they've set up structures for online supervision and team meetings, but they're missing the incidental conversations where you come back from difficult contact with a family and you can just have a chat in the office.
Yeah.
So I think within children and families, people who choose to work with children and families are by nature relational people. They've chosen to be youth workers or be social workers. So it's a very different way of working for people who want to be around other people and want to be having face-to-face contact with the people they support.
Yeah, and those kind of things that you were just talking about, spending a lot of time on your own and within your own family unit, they can lead to, I know, a lot of problems that you've been trying to tackle as well with the new Relationship Matters.
Yes.
Can you tell us a little bit about that?
Yeah, so the Relationship Matters website was the product of some partnership work that happens at a national level with the National Reducing Parental Conflict programme. Mm-hmm. And nationally, that's led by the Department for Work and Pensions, and it's delivered through a programme called the Troubled Families Programme. So that's a national programme that aims to support families with particularly complex needs. In Leeds, we call it Families First. So that's where it happens nationally. And regionally, we made a decision that the 14 local authorities in the Yorkshire and Humber area would work together. So our website's for the whole region, and it's, part of the Reducing Parental Conflict programme. What I would stress is that this programme is very much for families where relationships are generally healthy and positive and respectful. If people are experiencing domestic abuse, coercive control and other forms of abuse, we would encourage people to approach domestic violence services, and we've been putting out a lot on social media throughout the pandemic about domestic violence and abuse. This is aimed at people where there may be conflict in the family that does impact on children, but within the context of a family that's generally healthy and positive.
Yeah, maybe the problems have just gotten a little bit worse during the period of lockdown or something.
Yeah,
like that.
because of course it has been incredibly stressful when families are trying to balance working and homeschooling and being locked in the house, and not be able to get out more than once a day at the beginning.
Yeah, and all the uncertainty as well.
Absolutely, yeah, absolutely. We're very aware of the potential for children to come back to school very anxious because they may have experienced things over the period of lockdown like bereavement, witnessing domestic abuse, family breakdown, conflict. And it's been and also be very anxious about what the crisis means and, be frightened about becoming ill or people they care about becoming ill. So the website has things like, it has lots of blogs and advice and tips about maintaining healthy relationships. It's got links to the NHS and to Relate. And then there's also a link to each local authority and the resources that they have.
So is it like a type of helpline or that kind of service?
Yes, but online, yes, that's right. It's website-based.
And what kind of response have you got from it?
Leeds has had the biggest response, actually, in terms of the region, because we did the digital campaign. There's been a radio campaign. There's an radio interview with the head of our Families First programme during Mental Health Awareness Week. So it seems to have had a very positive response, and the website seems to be being used very well.
That's good. It's nice when you can feel like people are actually getting tangible kind of benefits from your service.
Yes.
So have you noticed the impact on families from kind of children not being in schools at the moment?
I suppose the first thing I want to say is I think the children of Leeds have been amazing through this period. They've shown a huge amount of resilience and creativity. So clapping for carers and drawing rainbows to go in windows. And there's a really lovely resource which was created by Breeze, who normally would be doing summer events for young people. And young musicians in Leeds, where they've done a remake of the Chumbawamba classic, I Get Knocked Down. They've done a song called Leeds Got Locked Down, which is just beautiful. It's really inspiring. So I think children have coped amazingly, but actually, obviously, it's a really stressful time for families, and children being out of school, although that was about managing risks around the pandemic, there were risks to children not being in school. We know that for some children, home isn't the safest place to be. Yeah. We've had a decline in referrals to children's social care because they're usually made through school, which is why it's been so important that schools are keeping in contact with families. And we're aware as well that academic gaps between children are being exacerbated by children being out of school, and that the quality of homeschooling that children are getting is going to be incredibly variable. So that's why it's important to find a safe way that children can return to school, because it's better for their education and their outcomes, and also for some children it's a safer place to be as well.
Yeah, and going back to what you were just saying about homeschooling, I know that was kind of the idea when everybody went into lockdown, but how kind of widespread is proper homeschooling been?
I think that's a worry. So it's been very variable. So I think for families where the parents have the resources in terms of the time, the ability, the equipment to homeschool, children will have been getting a good quality of homeschooling, although not the same level as being at school.
No.
But there will be children who haven't had any homeschooling at all, and where there's not been the space. You've got families living sometimes in really crowded accommodation. There may not be the space to study. Parents may still be working as key workers.
Yeah.
So inequalities that already existed amongst families are magnified by this period of lockdown and children not being at school.
Do you know of anything in place that's kind of going to monitor that when children do start going back to school and kind of filling up those gaps, or is it just going to be like as a normal school day would be?
I think we've been doing Zoom calls with head teachers. We've had up to 200 teachers on a call. It's been a really positive way of being able to keep in touch with them. I think schools and teachers are very aware of these gaps, and that they're going to need to work to help children catch up, but also they're really mindful of what else they'll be dealing with when children come back into school. As I mentioned earlier, there's the possibility of negative experiences children have had, like witnessing domestic abuse or family breakdown, but also being out of routine.
Yeah.
So children have got out of the habit of getting up and getting dressed and going to school. So I think there's going to be a period of adjustment that's really important. Our educational psychologists in Leeds are having input into schools, along with our early help hubs, to really create a holistic package of support for children and for schools as they make that adjustment.
Yeah, because as important as education is, it's not everything when it comes to children's mental health and things like that.
Absolutely. It's been a really disruptive time for children, and going into lockdown was a big adjustment, but going back to school will be a big adjustment as well.
Mm-hmm.
So getting children back into routine, them feeling safe in school, and being in school is going to be really different as well, because we've got to open schools with social distancing in place. The way they sit in classrooms, the way they play, who they can interact with is going to be really different. So children are going to need a lot of emotional support, and schools are very aware of that, and also the support the council can put in to support that through things like early help and educational psychology.
Yeah, because I suppose with new rules, like social distancing rules, it kind of opens up more opportunity for children getting in trouble, I suppose. So is there anything that's going to kind of monitor that? Because we don't want it to become, obviously, children getting detention after detention for not keeping their distance.
No, that's going to have to be managed really carefully. I think one of the things that will make it potentially easier is that children have to be taught in smaller groups.
Yeah.
So they're called bubbles. So in a class of 30, for example, you may have 3 bubbles with up to 10 children in.
Right.
So when they're first going back at the moment, children are going to be in much smaller groups, which will help with that adjustment and helping them getting used to the new rules and the new ways of being. I think teachers are very mindful as well that with, say, reception and year 1, which are 2 of the first year groups, to go back, 4 and 5-year-olds don't really understand social distancing. They'll forget. They'll want to run over and hug, their friends. The school where I'm a governor has written a letter to parents, which is really clear that the staff will try their hardest, but we can't guarantee perfect adherence to social distancing because it is small children.
Yeah, definitely. And this has led to a lot of I know a lot of local authorities have taken it upon kind of their own rules, like we're not going back to school because we don't think it's ready. What has been Leeds' response? How are they tackling the return to schools?
Yeah, so we put out a statement to do with expanding of children going to school and early years. And the approach we've taken is that it's up to the individual school and the Board of Governors to have more children in at a pace that feels safe and manageable for them. Mm-hmm. So I'm not aware of any school that's opening their doors today for reception and year 1 and year 6.
Right.
They're mainly doing it in a very phased way over a number of weeks, so starting with a very small number of additional children and building up gradually. All the schools are quite different. So just in my ward, there's one primary school where you can access every single classroom from outdoors. So their ability to do social distancing is easier than the school where I'm a governor, which has very small classrooms and very narrow corridors, and consequently they're doing a very gradual build-up because we can only have a limited number of children in the school and maintain social distancing. So we've left it to individual schools to work out with our support what's the safest and best way for them.
Yeah, that makes sense because, like you say, every school will have different needs and different possibilities. And I'm sure...
Yes, and different things like apart from the layout of the school, there are teachers that can't go to school because they're shielding or someone in their household is.
Yeah. So
there's all those different considerations that each school needs to take into consideration to work out what's manageable and safe for them.
Definitely. And I know that as going on from primary school, as children get older, obviously when they reach a certain age, I know that they can be quite difficult. What kind of advice would you give to some parents who might be struggling, in different ways to make sure that their relationship hasn't declined while these kind of stressful times have happened?
Yes, I think one thing that's really important with homeschooling, whether you're doing it all the time because you've chosen elective home education as your route for educating your children, or whether it's the situation everyone's been in over the last few months, it's really important not to turn your home into a war zone. It's still your home.
Yeah.
That's, there's the homeschooling part of it. And there's lots of different resources that are available. There's our early help hubs. We've got the Child Friendly Leeds website that has lots of resources and, tips for staying healthy and happy at home. We're very aware that the last few months has been very stressful for families that are trying to balance homeschooling with working, with everything that's going on around us, and not being able to get out very much.
Yeah, I mean, it'd be fair to say that the social and economic fallout from the virus might be just as damaging as the economic devastation that they're predicting.
Yes, and I think the economic and the mental health fallout of the pandemic will last a lot longer than the virus itself.
Yeah.
So the mental health charity Young Minds did some research where 25% of children that were in need of mental health support couldn't access it during the crisis, and 67% of parents questioned said they were concerned about the impact of the virus on their mental health. Right. And we're expecting a big spike in youth unemployment already. Young people have borne the brunt of the economic fallout in that 16 to 25-year-olds are most likely to be employed, in bars, restaurants, cafes, all the places that have closed down. So it's really important as we move forward. That's why I wanted the Future in Mind board to continue to meet during lockdown, because we need to make plans for how we support children and young people going forward through things like our early help hubs. Our youth service we haven't been able to do youth work as we usually would during the crisis. We've had youth workers redeployed to work in children's homes, to work in early help. They've also been working in Safe for Leeds with the police, where we've had young people out on the streets not adhering to lockdown. So there's going to be a need going forward for the council and the NHS and the third sector to very much work together to plan the mental health support that we need for young people going forward.
Definitely, and a lot of this support that I'm sure is involved with your job, how are you kind of finding that? Because obviously the connection that will come from meeting people in person and supporting them, physically, surely it's not been the same during this time.
No, really interestingly, in some areas doing things digitally has enabled more children to get involved. So some children and young people really thrive in the digital world and find it easy to engage in the same way, although I said earlier being out of school has had negative impact for some children. It's been a relief not to be in school. They haven't got the pressure of exams. They haven't got the stress of things like bullying. For some children, particularly children with social and emotional difficulties, children on the autism spectrum who may struggle with going to school. Obviously, not all children on the spectrum do, but for some children, their mental health's been better not going to school. And similarly, some children have engaged with services that they wouldn't engage with if they had to do it face to face. But obviously, on the whole, there is some loss in not being able to do the youth groups and the face-to-face support that we would normally do, and we will gradually build back up to doing that in a safe way.
Yeah, but with more people being able to access it, would that mean that you would continue some of those practices in the future as well?
Yes, what we're identifying now is what we will keep doing that we started doing out of necessity, and a lot of that will be the online work. There will be some meetings that we will continue to have online. There'll be some that will go back to doing face-to-face. There'll be some work with children and families and some youth work that will continue online, and some will go back to doing face-to-face. So, yes, we have loads of new ways of working as a result of the pandemic and what it's forced us into.
And I want to kind of round it up with a really positive way of looking at things. I was wondering whether with your expertise in children's and families' lives, you could maybe leave the listeners with one idea for an activity or anyone that's listening, and they might have had a bit of a stressful time over this period, one too many slammed doors. What could they do with their families over the weekend that might, put everyone in a better mood and reduce tension, things like that?
So the Child Friendly Leeds blog has lots of ideas for creative work that young people can do. Also, we have a fortnightly competition which is on Twitter. The hashtag is #OurChildFriendlyLeeds. Every 2 weeks there's a competition where children can do something creative and there's a winner announced. So the last competition that I judged was about VE Day, and the little boy who won had made a Spitfire from scratch with his dad. He'd made a potato dish that was a World War II recipe called Potato Jane from when they were on rationing. And he'd also written a diary entry as if he was celebrating VE Day at the time. So that's a really lovely thing that happens every 2 weeks, where there's lots of creative ideas in the competition.
And I guess that's kind of only open to people in the Leeds region.
Yes.
But maybe it's something that other local authorities listening might want to kind of jump on and do in their areas.
Yes, we've had a number of different areas come to visit Child Friendly Leeds to look at setting up something similar in their areas. So we're always really open to people coming in, trying to get more about Child Friendly Leeds if they want to do a child-friendly initiative where they are.
Oh, well, that's brilliant, and I really want to thank you for speaking to us today. I think a lot of people are going to find it really interesting to hear from somebody like yourself with everything that you know to do in your day-to-day job and how it might have changed. So thank you very much.
Oh, you're welcome. Thank you for having me. It's been lovely talking to you.
Brilliant.
Really great to speak to Cllr Venner. Don't forget to tune in to next week's episode. We'll be speaking with Sir Richard Leese, leader of Manchester City Council. See you then.